Good morning. Thank you again, and once again, good morning, buenos dias. What a great day to be here at the Orange County Convention Center. I'd like to personally thank each of you for your commitment to our Hurricane Maria evacuees. By working together, we have helped to make a difference in the lives of vulnerable families and children. Today, we continue that work, and of course, tomorrow we'll host a region-wide Expo. To Major Jacobs and the entire Orange County Convention Center, I can only imagine how hard you and your teams have worked to welcome us to this important pre-Expo breakfast. So again, thank you. At this time, I would like to thank our standing sponsors. Obviously, their support has been invaluable, not just for presenting our breakfast and tomorrow's expos, but in caring for our community as a whole. So to Florida Hospital, outstanding community partners, and a rich resource for many areas of health and wellness throughout Central Florida, thank you. To the Nemours Children's Health System, a proud leading advocate for our children's health and wellness throughout the region, again, thank you. We are also delighted to thank our media sponsors, including Telemundo 31, La Prensa newspaper, Osceola Star newspaper, 107.3 Solo Éxitos radio station, and Rumba 100.3 radio station. The beautiful centerpieces that you have at your tables have been a generous donation by Silvet Vacation Homes and Advanced Physical Medicine, so thank you. I don't know if you can take them home, but that's kind of like a Puerto Rican tradition, so you figure that out on your own. I will also at this time thank some of the public elected officials that are here. If you just made it in, make sure to stand to be recognized, but I know we have Peter Clark, Orange County Commissioner on District 3. Victoria Ziplin, Orange County Commissioner, District 6. Thank you. We have Betsy Vanderlee, Orange Commissioner, District 1. Cheryl Grieve, Commissioner for Osceola County. Rod Love, Orange County Commissioner, District 2. And Jose Alvarez, Mayor for the City of Kissimmee. Anybody else that I missed or that you would like to be recognized? Yes, go ahead.
Representative Mike Miller's office, District 47.
Thank you so much. Again, thanks all of you for being here, and we do recognize your leadership. And welcome to the rest of the attendants here in this beautiful morning here in Orlando. Now it's my pleasure to introduce Teresa Jacobs. Orange County Mayor Teresa Jacobs is in the home stretch of her second term as mayor. And for those of you not familiar with this region, I'd like to say for the record, Mayor, we will miss you. Not only is Mayor Jacobs well known as a champion of ethics reform and for encouraging strong public participation in the governmental process, she's a stout advocate for broadening Orange County's world-class recreational and performing arts venues, and for leading far-reaching sustainability efforts to ensure a healthy and prosperous future. Mayor Jacob is also deeply committed to job creation and in particular to nurturing our tech, digital, and modeling with simulations industries. I can tell you firsthand how much UCF has valued her partnership and leadership in this area. Go Knights. But most of all, I think that those of us gathered here this morning are admiring and appreciative of her focus on strengthening the safety net for those in need. Through her administration, she has been unrelenting in seeking to impact domestic violence, child abuse, homelessness, affordable housing, and youth mental health, and in all in an effort to make Orange County the best place to live, work, and raise a family. As many of you know, following Hurricane Maria, Major Jacobs joined with many community and governmental partners to help the families of Puerto Rico and the U.S. Virgin Islands recover from the devastating storm. And as a brief historical reminder, despite the fact that Orange County has suffered more than $50 million in damage from Hurricane Irma. Just 10 days earlier, Major Jacobs and others, including Osceola County leaders, mobilized to offer comfort and aid to evacuees, much of the time before state or federal agencies were even on the ground. Major, we are so pleased to recognize your efforts throughout your administration and to offer our thanks for your work in organizing this breakfast and tomorrow's Expos. Ladies and gentlemen, please join me in welcoming Orange County Mayor Teresa Jacobs.
Gracias, Dr. Herrero. What a wonderful introduction, and buenos dias. Bienvenidos. It's wonderful to have all of you joining us today as we prepare for tomorrow. Thank you so much for coming out. You lend so much support to our whole community, but you've been so instrumental in the last year as we've welcomed so many new members of our community and visitors to our community who I know are still looking to return home. We couldn't do this without you for the last year to welcome our visitors from Puerto Rico as well as those from the Virgin Islands. And I wanted to take this opportunity, one, to thank you, and to two, welcome you this morning. Tomorrow we look forward to being able to share with people that have recently arrived here and even some of our Hispanic neighbors that live here, some of the important things that they need to know about resources that are available. This really began, I need to give credit to the Secretary of Health with Puerto Rico, Secretary Rafael Rodriguez Mercado. He's not here with us this morning, but he will be here with us tomorrow. This was actually his idea. I had the privilege of meeting him a few months ago, and what an incredible man. I'm going to let his Chief of Staff talk a little bit more about him when she comes forward in just a minute. But it absolutely astonishing record of service, both as a medical physician and surgeon, but also as a public servant, and the time that he has invested and volunteered to serve as the secretary in Puerto Rico. He is doing this, as I understand, without pay, which is quite phenomenal, but it just shows you the caliber of the human being that he is. If you'll be with us tomorrow, you will enjoy having the opportunity to meet him. He is also just obviously a very kind and compassionate man, so he'll be with us tomorrow. And one of the things that he's going to talk about, and his Chief of Staff who's with us is going to probably talk about a little bit, is that, depending upon your background and your heritage, we all have slightly different dispositions to different types of medical challenges. And we have learned that it's good to understand where your vulnerabilities are. And that's one of the things that we wanted to focus on as well as making sure that everybody that comes tomorrow understands all the wonderful ways that you can help them make this either their home or continue to make this their temporary home while they're with us. But we've also learned, and Dr. Sharon will be on our panel, he is very aware of the value of awareness campaigns, of opportunities like this to talk to people and to make sure that they're reaching out and getting the tests that they need to do for the vulnerabilities that they might have from a health standpoint. So at this point, I'm going to invite the Secretary Rodriguez's Chief of Staff. Those of you who know me, you know my Chief of Staff, Graciela Noriega Jacoby, and you know that without a Chief of Staff, I would say, is kind of like, for every good woman, behind every good woman, there's a good man. Is that how that goes? Commissioner Grieve, is that how that goes? Now, I might have that backwards. But the bottom line is, behind every good public servant, there's a great Chief of Staff. And so it is my great honor to introduce to you Mabel Cabeza, who is the Chief of Staff for the Secretary.
Thank you. Buenos dias. Thank you for the invitation, Major Teresa Jacobs. On Thursday, September 20th, 2017, Puerto Rico lived the devastation that we all know caused by Hurricane Maria. All of the country's services were affected, and many of the Puerto Ricans who lost everything embraced the American citizenship, leaving their land behind to come to the United States in search of new opportunities. They joined many other Puerto Ricans who has previously decided to try their luck in the United States. Know that even from afar, you are part of the Puerto Rico that you left behind, either temporarily or permanently, and that we will continue fighting for a better future. You remain our responsibility, and we harbor in each one of you the hope that any moment you can return to your homeland. Therefore, today we are here creating ties with the state government and Major Teresa Jacobs and facilitating many of our service tomorrow at the Health Expo, such as the formalities of the official documents of the demographic registry and service offered from the vaccination department. Puerto Rico is making progress in its recovery, and we need our people from the diaspora to be part of this process so that everyone can enjoy quality of life. The Puerto Rico Secretary of Health, Honorable Rafael Rodriguez, he will be tomorrow with us all day, will not cease to work on the reconstruction of our health system so that when deciding to return to the island, you will have a safe home to go. He is eager to join us tomorrow in the Health and Family Expo, and we congratulate Major Teresa for such an amazing initiative, and we are very happy to be with you guys here with your team. Thank you. Puerto Rico se levanta.
Thank you so much. I also wanted, we already recognized elected officials, but I do want to point out that we are doing this in partnership with our neighbors to the south, Osceola. Osceola has been welcoming so many of our Puerto Rican families, particularly into their community, and I have been trying to keep track of the number of families, both Puerto Rican and Virgin Island families, that are still in our region, and a great number of them are in both Kissimmee and Osceola. So we have partnered together in this. I wanted to recognize Mayor Alvarez, which stood up a minute ago, Mayor Alvarez from Kissimmee, who's played such a vital role here on the ground as well as in Puerto Rico, as well as I mentioned, Vice Chair Cheryl Grebe. Another person we didn't mention, but I think has been invaluable to us here locally, as well as the role that she has played for Puerto Rico, and that's Ilia Torres with PREPA. Ilia, if you'll stand up. So you're covering the whole state of Florida, but we are so very fortunate to have her right here. And she should be right here, because when you think of where Puerto Ricans have made home, Central Florida is the center of home for Florida. So we're very honored to have that role. The partnership that we've enjoyed in this expo it embodies who we are. It's what our region does. We are all about working together, collaboration, and also we're all about compassion. So it is no surprise that you all are here today. I also wanted to recognize the role that our education universities and our K through 12 have played in this. So we have Scott Howard here. Scott, thank you. Scott Howard with Orange County Public Schools. The role that Valencia has played, the role that UCF has played, it's been a remarkable opportunity to welcome in so many people. And I know that our K through 12, our Orange County Public School System has also employed quite a few. I've actually had the opportunity at one of the events to find a couple of teachers looking for a job, and bilingual teachers are priceless in our community. So it's been a great marriage as far as that goes. And when you think of zip codes as home, I think a lot of people think their house is their home. To us here in Orange County, home is much bigger than a house. Home is a community, and home can move with you when your friends and family move with you. So for everyone who has made this their new home, we look forward to welcoming them tomorrow as well. And with that, I am going to relinquish the mic and say que Dios los bendiga, and invite back to the mic Mr. Rivera.
Thank you, Major Jacobs, and thank you to the Secretary of Health from Puerto Rico as well. Thanks for those remarks. We would also like to recognize, I know he's moving, Carlos Guillermo Smith, Florida representative, that joined us. Also from the Senate, Victor Torres. So thank you for joining us this morning. I just realized that I did not introduce myself at the beginning of this. Just to give you a little background, I'm Fernando Rivera. I'm an associate professor of sociology at the University of Central Florida, and I'm proud to say that I'm also starting the Puerto Rico Research Hub at the University of Central Florida. So this is kind of like the first event that I have publicly put that out there. So I look forward to contributions from all of you. We cannot do this alone. Now it's my pleasure to introduce the panelists. What I'm going to do, I'm going to read through their short bio, and as they come in, you can join me on stage. So our first panelist is Ginette Giddens-Roberts. She's the president of the Caribbean American Chamber of Commerce and CEO of GGR Marketing and Public Relations. She is responsible for developing and directing their communication strategy while also managing the agency's outreach to the advertisement, charitable, and business communities. She's also the publisher of Caribbean American Passport News magazine, the largest Caribbean-owned statewide newspaper in Florida, covering the people of the English, French, and Spanish communities. Through their public publishing arm, they were responsible for the publication of Misión Boricua last year, a Spanish publication designated to raise awareness for the Puerto Rican community to vote in last November's elections. A native of Georgetown, Guyana, Ginette is active in the community, serving for the past 7 years as president of the Caribbean American Chamber of Commerce, vice president of Central Florida Association of Black Journalists, vice president of the Guyanese American Cultural Association of Central Florida, program director of the Caribbean American Business Expos, and vice president of the Caribbean Affairs at Realty World of Orlando. So welcome so much to the stage. Our next panelist is Scott Howard, Chief Communications Officer at Orange County Public Schools. He attended Orange County Public Schools before earning his bachelor's degree in Political Science and Government from Rollins College. He earned a Master of Education in Educational Leadership from the University of Central Florida. Again, go Knights. For more than 26 years, he has worked to help the students of Orange County Public Schools to success, initially as a social studies teacher and then administrative dean, assistant principal, director of legislative and congressional relations, and since 2016, a chief communications officer for Orange County Public Schools and president of the Foundation for Orange County Public Schools. Marnie Stallman, president and CEO of Shepherd's Hope, has a 30-year career in C-suite healthcare delivery management in Central Florida, with areas of influence ranging from strategic alliance, board development, and clinical quality and management to government affairs and regulatory compliance. She is currently president and CEO of Shepherd's Hope, Florida's largest free and charitable clinic, a national recognized nonprofit health and human services agency. Marty holds a Bachelor of Social Science degree in psychology, dual Master of Science degrees in counseling and psychology, a PhD ABD in psychology, and a management certificate from Rollins College. Welcome. Ilia Torres is the regional director for the Puerto Rico Federal Affairs Administration. She's a native from San Juan, Puerto Rico, currently serves as the regional director for the Puerto Rico Federal Affairs Administration, Office of the Governor Ricardo Rosselló. In this role, Ms. Torres is responsible for implementing the public policy and matters of interest of the government of Puerto Rico within her assigned region. Before assuming this role in April of 2018, she served as the agency's director of legal affairs. A lawyer by profession, Ms. Torres received her Juris Doctorate with honors from the Pontifical Catholic University of Puerto Rico and her bachelor's degrees in criminal justice from the University of Puerto Rico. Ms. Torres is admitted before the Supreme Court of Puerto Rico and is fluent in English and Spanish and with basic proficiency in Portuguese. So thank again all of you for being here. What I'm going to do, and kind of like my charge out here, is go through a series of questions to illustrate some debate. So I will, ask the the panelists, to be aware of time, I will also like to have some time for the public to actually ask some questions for the panelists. So this is fun because I usually don't get to ask too many questions. I get to answer them. So we're going to begin. And again, I'm going to have some specific questions for some of you, but feel free to chime in at any time if you feel it's appropriate out here. So just to begin, and this is for Ilya and Gannett, let's discuss what the newly arrived Puerto Rican Virgin Island population in Central Florida looks like. Who are they? What are their goals? And what are their greatest challenges?
Virgin Island, I will defer to Gannett to describe that population, certainly.
Well, my office is based in Fashion Square Mall, and I was actually discussing this with Ilya at our table earlier. We're getting both walk-ins from people who've been displaced from Puerto Rico as well as Virgin Islands, and we're noticing a lot of business people, a lot of musicians. That's definitely something I think that we've seen more than most. Is a lot of musicians walking in and asking, well, how could I get involved? How could I do more? Who do I reach out to? But we definitely have a lot of business people who are walking in saying, I have to start over, and how do I start over? Where do I start? Now, the Entrepreneur Center is also located in Fashion Square Mall, and one of the things that we did in the first wave when we were doing all the outreach efforts was actually we sat down with the Hispanic Chamber President, the African American Chamber President, and we kind of strategized about how we could help these business owners. Both of those chambers are going through changes at the moment, so I know that the people we sat down with at the time aren't there, but I've been noticing a lot of business people walking in, just saying, how do I get started?
Yeah, from what our offices have seen, a lot of these Puerto Ricans exactly are between the ages of 20 to 50 years. Most of them will have a family of between 1 to 5 family members. We have also seen cases of elderly people as well moving along with their daughters and sons. And as well, we have seen disabled children are coming along with a lot of those family members. Between 20 to 50 years of age, they're still in their productive years. So most definitely, they're eager to be able to enter the workforce and continue practicing their own profession that they did back in the island, and so on. So that's basically the profile my office has seen. A couple of business persons here and there, but mostly professionals.
I think I'd like to add, too, who they are and what they look like also falls into what their greatest challenge is, at least in our organization, because I think there's a lot of misperceptions in the communities, especially here in Central Florida, of who some of the citizens coming from Puerto Rico are. And we're seeing that they're highly educated. Mm-hmm. These are business owners. These are people with bachelor's, master's degrees, individuals that were in positions of stature in their communities back on the island. And they've, as they've said, they've come here, and the perception that the community has of who they are as individuals and as their families are very much not in keeping with who they are or who they were. And that is a great challenge as we try to overcome some of our cultural diversity and misperceptions about who some of these individuals and families are in the community. So I think who they are and what they look like falls also under the category of what some of the challenges we have about educating our own communities here in Central Florida.
I couldn't agree more with your comments.
I do want to add, too, that everyone that I've seen actually has come with a family as well, which is very important. I'm not actually seeing, a single person. I'm really seeing family units. So at least, 2 adults and 2 kids at the very least. So that's what we're definitely seeing.
Certainly in the very beginning, as we started to see patients arriving, especially in that first month into the clinic, we were seeing nurses, we were seeing doctors, we were seeing teachers, lots and lots of teachers.
And that goes on to the challenges. All these professions are licensed professions. they find themselves unemployed because they find it difficult to transfer over their license from Puerto Rico to here, because there isn't reciprocity, because some of them have to start over again, take courses, it's expensive. Of course, when you don't have an income and you need to decide whether to eat or whether to get your license and practice your profession and provide for your family, then what we have seen is a lot of them end up in low-wage jobs or entry-level positions, which makes even more difficult to secure stable housing and all that comes with it.
Right, because we actually had some people walk in from Virgin Islands that were, I guess, in the security field, but they didn't have the right licensing to operate here. Fashion Square Mall was hiring at the time, and they said they will help get them the right licenses, but that was an issue. And that guy was walking around the mall with his family and just saying, I just like something so I could get off my family's couch.
So a question for all is to discuss the healthcare provider system that recent arrivals from Puerto Rico and the U.S. Virgin Islands are accustomed to, and how it differs from the system here in Florida.
We need more than an hour. So many of the individuals that we see or saw at Shepherd's Hope were not familiar with the healthcare system here. We have a number of obstacles. Language certainly is the first and foremost. But the system in Puerto Rico and on the island, they were used to seeing access, which was probably chief among the differentiations here in Central Florida, the state of Florida. Access, as we all know, we could have a conversation for a long time about access to healthcare services in the state of Florida. So that's the chief problem. And what we saw was the differentiation between what was considered coverage, where they had potentially insurance, whether it was self-insured, private, or Medicaid, because those block grant recipients were transferring here to the United States and they weren't covered. We were very fortunate that we had some state representatives that are here this morning that fought ferociously along with our federal legislators to work to try to educate at a federal level and get some of those restrictions lifted. But even in the beginning, it took months for Health and Human Services to start recognizing, and we're still seeing it nearly almost a year later where we still have many, many barriers. And the individuals that are coming into our clinic, even on a good day here in Central Florida where people understand how to navigate the system, it's incredibly difficult. And now put on top of that the trauma that they've experienced having to come here. They've been displaced. We have language barriers. We have the misunderstanding of how to access. And Shepherd's Hope really became ground zero here in Central Florida for seeing the majority of the patients, as did many of our community health centers that also took up the cause, and I know our own Orange County Health Department. And so it was very, very, very complicated and very difficult, and we're still dealing with it.
Any other insight of the panel in terms of?
No, I agree with what she expressed. From my years living down in the island, those who were on Medicaid were a part of a managed care organization where if you get sick, you go and then you get a referral, and everything is kind of a bottleneck, or if you don't get the referral from your doctor, then you don't get XYZ service. And that's for those on the Medicaid side. If you're on the private insurance side, then you have more freeway in terms of provider selection and all that.
And what I'm seeing on my end is just a lack of understanding the process. And so we're just helping to answer questions and just making people feel comfortable starting the process, because I think feeling overwhelmed is actually stopping some people from even trying to access the services. That's what we're seeing on our end, because all we're doing is guiding and saying, you do have access to these services, start here, or try a community agency. But it's just somebody to hold their hand and walk them through the process.
You know, even something as simple when Health and Human Services put out some of the information that the Medicaid recipients would be able to how to apply now and have their services transferred over. They didn't print the information in Spanish. It's printed it in English. So we're still seeing even the most basic of roadblocks still in place where they could easily be ameliorated and they're not being. And then I guess that again goes to cultural sensitivity and understanding that we need to be aware that these are individuals that need to be spoken to in their language.
Right.
And language sometimes isn't just the words.
My
That's
office
true.
is more than happy to assist with any of those initiatives. I perhaps wasn't there heading the office when that happened, but we know we not only know their language, we know the culture. So sometimes you will have to send material translated to a translation agency. They don't speak the Puerto Rican Spanish that we speak. So we will be more than happy to help with anything related to that effect, most certainly.
And for the Virgin Islanders, I would say, again, even though it's English speaking, it's just not understanding the process and just wanting someone to help guide them through it. So I can imagine with the language barrier also being an issue, but it's just not understanding the difference and just wanting someone to sit with them and that could just be a volunteer, and that's what we've done. Again, just volunteered and said it's not hard, and this is something that's available, but.
For a minute, let's put ourselves into their shoes. They went or were survivors of the worst natural disaster in modern history. They definitely suffer a traumatic event. They came here basically without anything at all. And they don't know how to navigate the system. They don't know how to access healthcare. They don't know how to access food stamps. All of that. By the time they get to you, they're so frustrated that some of them might bend and discharge their frustration when you have it in front of you. That's not the typical Puerto Rican, I want to say. And to that end, I will ask all of you, be culturally sensitive for one step back and think about what they've been through and try to accommodate as much as you can to what they're asking from you, what service they're seeking from your office.
Yeah, and I think just observations of kind of like what I went through in terms of, when people coming in, translation is not Google Translate. You have to make sure that if your agency, you don't have, and this is a reality check on sort of the personnel that you have to deal with an incoming population. And I think the other thing that you brought up is sort of the collective trauma of what happened in Puerto Rico. I think that's something that we still need to address in terms of mental health consequences of some of the issues that are going on that have been put in the back burner because people are just struggling to survive, but that's still in their mentality.
But it will trigger at some point.
No,
I think
absolutely, and that's
here.
something that we should all be aware of.
I think it's here.
Yeah. So I'm gonna have some questions for Scott, and while we answer, I'm kind of like gonna transition into the seat, and can somebody mic me up? I'm kind of like talking up here down to you. But Scott, the families that arrived to Central Florida after the devastation of Hurricane Maria in the Caribbean brought children, mostly 8 children. What impact did they have on the school system?
Yeah, so, first I want to say it's great to be here to talk today about this issue, and certainly a year out looking at the children impacted. We, as mentioned before, impacted by Hurricane Irma, but even before that, Hurricane Harvey, we started receiving evacuees even from Houston, and so we were starting the process of recognizing that we were going to get additional students. But then as Irma hit, we started to get evacuees from South Florida, from the Virgin Islands, and then, of course, Maria. And so the impact really, as we were beginning to ramp up some of those services and recognizing that we needed to start to identify the areas that would be most impacted, and started to do that and track it. I think from our standpoint, beginning in October and receiving about 3,500 evacuees from Puerto Rico alone between October and the end of March was a huge impact. It was a huge impact to the collective budget of the district. Certainly our budgeting cycle doesn't accommodate necessarily a huge influx after a certain period. We do our student counts in October for budgeting purposes, but many of the evacuees came after that point in time. So getting direction on how we were going to address the needs of the students, the physical needs of the students to get them in. So one of the things that we certainly did right away was to waive a lot of the requirements, at least take action that we could take under the law, and be able to just get the students in this school. Let them get in, get some normalcy of being in school. And that was our priority, making sure that they weren't held up by shot records, or they weren't held up because they didn't have transcripts from their other schools. We understood that Puerto Rico was having a difficult enough time just getting basic services up and going there, let alone and we know the electricity issues and internet and all of that. So just getting with the parents and getting them back in school. I think the Welcome Center was huge for us. We had a presence there the entire time, both from our HR staff, from our human resources staff, but also student enrollment, giving parents information and making sure that they knew where they needed to go and what they needed to do to enroll their children. We certainly can always use teachers and always use employees, and so being able to hire those individuals that were coming that wanted to work, the professionals that were coming, the college professors and other educators, and we hired about 70 individuals over that period of time. 50 of them were teachers, and so waiving some of the requirements for certifications, making sure that they could get in, getting transcripts at that time for them was frustrating because being able to, their colleges were shut down that they attended maybe in Puerto Rico, and they couldn't get the information, but working with them in order to get them in and transitioning them in was important. So to answer your question, huge impact to us, but I think the impact was spread out enough at the elementary level that we were able to deal with that impact. We're a high-growth district. We get 5,000 new students a year. So we're used to that, and we're building capacity for that. We're certainly not used to getting a mid-year. We like to have a little bit of plan, but I think knowing that what we had to do and how we had to do and trying to get direction from the Department of Education was a challenge for us at times on what to do with them as far as especially our seniors and graduates. So. But we can talk about more of that, too.
I was going to ask you, for the benefit of the audience that perhaps is not aware, to comment on the interagency agreement that the Tri-County area entered with the Department of Education to help seniors graduate. They might not have that information. It would be great if you can share it.
Yeah, so we received about 102 seniors who obviously were in their last year of high school and needed to find a way to get to college or get to a career afterward, and trying to put together a communication agreement. How are we going to get them to that point? And certainly there was talk of issuing a Puerto Rican diploma to those that qualified, or issuing a Florida diploma, depending. But language became an issue in that because in order to get a Florida diploma, you have to pass the Florida Standards Assessment, which is given in English. So how do we get a diploma to these students so that they can go on? They had plans, certainly, when they were in Puerto Rico, and dreams of going to college or getting a career, but how do we fulfill that? And so we worked with the other districts around us, and certainly didn't get the information from the Department of Education, either at the state level or from Puerto Rico right away. So just to continue to try to work with them and with their families to get them prepared so they could be ready. And so we did a lot of that. We had 82 of our 102 actually graduate with a Florida or Puerto Rican diploma, which we thought was an outstanding for them accomplishment. And those that didn't graduate were in summer school, and we were getting them through and finished, maybe a credit or two that they needed here or there. So we worked very hard to make that happen. And now we have rising seniors, juniors last year that we're working with to make sure they're on the same track. So.
Thank you.
Mm-hmm.
So thank you for sharing all that information. Is there any challenges that still need to be addressed? And
and going back to the challenge, I have the privilege of serving as the president of the Foundation for Orange County Schools, and as was mentioned earlier, I think Marnie mentioned that a lot of the individuals, families that came here with the clothes on their backs, with one or two suitcases full of their possessions. And so our challenge at the time was making sure that the students, not only were they in school, but they had the resources that they needed. And this community has been amazing, the outreach, the partners that reached out to us to provide clothing and school supplies and backpacks and all of that. And we're continuing to utilize some of those donations in order to make sure that the students that are coming back into school have those things. 3,000 backpacks, raised about $114,000, different grants for different areas across, dealing with just hurricane-related issues. But those issues still exist, and making sure that our students have what they need to be successful in school, and some of those basic needs being met. We certainly are doing that. As far as language goes, we know the students are served in their ESOL classes. They've been assessed. They're being provided those services as they're being identified. But I think just making sure that we're working with them, and certainly many of the Puerto Rican families that came and the students that we were serving are homeless. They don't have permanent housing, permanent residence, and so working through those issues to make sure that there's as much stabilization in their lives. And our homeless department within the school district has ramped up their efforts as well. So
I think that's the next kind of elephant in the room. Affordable housing is on the front page of our papers here locally. It's been an issue here in our community that's been rising even before this occurred. And now we've added this. Certainly the government and the officials in Osceola County have been dealing with this issue themselves, and they've kind of taken a major hit and a frontal attack on it. I think it goes to the underpinnings of everything that we're talking about when you're talking about a whole individual, the continuum of that person, their mental health, their stability, and certainly as a survivor of a traumatic event, the mental health component, the behavioral care component. When you take all of that into consideration, and now these young children, elementary school age, are coming in and they have the language barrier and also somewhat of a cultural barrier about how to disclose, how to share. There are certain elements within each of our cultures that do or don't maybe allow for the free exchange within a family component or in a community component, and how you share what's going on with you emotionally. And I think mental health, behavioral care is the next big issue, and that is tied in explicitly to the fact that they don't have a house, don't have a bed that they call themselves. And a house can be figuratively a lot of different things and how you picture that. But certainly having your own bed, your own blanket, your own pillow as a young child makes a lot of difference. And that stability, and that goes into their instability fear that was occurring at the time that the hurricane happened, and the trauma of all of that, and then just leaving with nothing. And we have a huge issue here in our state about the lack of funding and affordability for the provision of mental health and behavioral care services, and adding this population into that mix. And I don't see many answers coming. I know we have, again, wonderful state representatives that are here. Senator Torres, I know, Carlos fights, but they're too in a sea of others that are up there that aren't listening, and we've got a problem here.
I think one of the, and certainly, we all, the tragedy that happened in Parkland earlier, and the small, minute blessing that came out of that was additional funding for mental health in Orange County schools, and we received about $9.1 million to add additional mental health counselors and school psychologists.
But wasn't it true that some of that funding that should have come to Orange County wasn't here because Orange County had already taken steps before Parkland to secure the health and well-being of our students? And so some of the money that could have come here to help support that, actually, we didn't get because we had already done such a good job with it.
As we all know at the state, sometimes when you're ahead of the game, you get punished for that, right? So you prepare and you do things ahead, and they say, well, you're good, we'll give the money to those that didn't prepare ahead of time. And certainly we did some of that, both on this, obviously the safety and security side, but on the mental health side, we've been able to invest in about 50 additional 50 positions that will help support all of our population, but certainly those that are still dealing, with the distress of being pulled from their homes.
Sorry to take your question, but I'm curious, of the 50, how many of them are bilingual?
Well, and we're sensitive to that. We certainly hire to make sure that we have that, and that's in all of our our job descriptions to say bilingual preferred. So we're always looking for that, and certainly there's opportunities for those that have moved from Puerto Rico that come here that are trained mental health counselors or school psychologists or psychologists to enter that field. So.
And that's maybe, again, where reciprocity comes in. As a psychologist, I can tell you we don't have state interoperability for licensure. And so and I know that these people could be helping Scott and his team,
sure.
and we're not seeing it recognized.
Yeah. And I could just add to that I think centers and places where people could feel a sense of community that they've lost. That's a very important component that, these counselors that, might not technically be able to practice could actually just sit and talk to these people because they're missing that. They need that. That's really very important. So I think we need to establish more places where people feel like they have a safe sense of community that replicates the village that they left, the community that they left.
That's been the thing that we've really tried to instill, and I know, excellent teachers create classroom communities where, students feel accepted and they work harder, and so creating that within our schools, and our schools in a lot of cases became those places. I know that down in the Meadowwoods area, the elementary school held a number of just bring the community together to make them feel, people that were kind of dealing with the same issues, and how can we help through those issues. So the schools and the principals in those schools really tried to lead because they knew what their families were dealing with, and ultimately it would help their students get a sense of stability. And so a lot of the schools became that. Colonial High School was one of the high schools that were most impacted, and they did that. Jose Martinez just did an outstanding job there with his families and building that sense of community. Lake Nona was heavily impacted as well, and they did the same thing. And I think that's a big part of it. I mean, in education, we value that certainly.
One thing, too, and I know we're talking a lot about Orange County, and I see friends here in Osceola, and I want to give a shout-out and an acknowledgement. And one thing that's not represented maybe here on the panel today is the faith community. Because the faith community, especially in the Osceola community, really did step in, and especially from a housing perspective, and was able to help on any number of just the most basic of human needs. And we haven't maybe seen that as much in the Orange County community as we have seen it, and it's been incredibly effective in helping to create that spirit and that sense of permanency and that sense of unity and family back. And we've certainly seen that at Shepherd's Hope, where many of the referrals are coming from our faith partnerships, where they're coming in and having them come to us. And so I would really encourage, from an Orange County perspective, to maybe take a look at what was modeled over in Osceola and how they brought the faith community over and brought them into the mix, because we are seeing that that's where the families came to. When they did have a connection, familial, it was through the faith. And it made a big difference.
And they're still there. They're still working with that community. With those who are on DSA, they are providing rental assistance, rapid rehousing programs. But again, we go to the lack of affordable housing. So I see it as a vicious cycle, because everything is dependent on another factor that it's probably not there.
But we have seen, though, in Orange County with what was done with the Commission on Homelessness, though, that if you tackle the issue of how to give someone a permanent home, some of those other factors become less impactful, because you've now addressed them on a continuum.
Right.
So there is a model that I think we could look at that's been established,
houses.
but we have shortages of houses.
That's the problem.
I do have to say, and on the faith-based side, the Superintendent Jenkins has had a faith-based advisory council that she established 6 years ago, and it's been in place, and it's 24 members from across all faiths that get together quarterly and talk, and they've been amazing in the volunteer work that they've done in providing some basic needs. So from a school system perspective, we have that in place. We have 139 faith-based partners that we work with across all faiths. We have an advisory council, like I said, that meets regularly, and we push information through that faith-based newsletter that they can share with their congregations. So you're right. Reaching those individuals within those faith communities is important, because that's where the community is.
Yeah.
That's where a lot of our residents build community, is in the church, because that's where they find, in synagogues and other places, where they find that community.
It's where they're looking for that sense of recreating that sense of feeling connected, but also safe.
Right.
Yes.
Exactly.
We actually were able to model that through our nonprofit partners. So I know Virgin Island Worldwide organizations out there, they're a very active partner, and CAFA, which is down in Kissimmee, is another one, and Alpha Point. We've done that through the nonprofit groups primarily, and they have really stepped up and helped in a major way, and they're the people who have been on the ground, actually sitting in the resource center a lot of times and just talking and guiding and just saying, this is where you go. So they've done that, but I just saw the importance of it to the people. It was minor information in our eyes, but it was very, very, very important. It felt, I think, like a lifeline to a drowning person, and it was just an ear that wasn't hurried. It was just a person willing to sit and listen to them. And so that's why I think it's just important to model more of those kinds of centers, because I don't think that we understand how important it is for these people to just feel heard.
And that's a great segue for a question that I have specifically for you. But before I do so, I want to recognize Brandon Jensen for Representative Camilla Brown and Representative Darren Soto that is in attendance here today. So thank you. So again, you talked. We've talked that the majority of evacuees after Maria have been from Puerto Rico, but there was a great number of them from St. Thomas, St. Croix, St. John, the U.S. Virgin Islands. What has been the experience of these evacuees, and where and how are they now?
Well, the one thing that I do want to point out is that Virgin Island Worldwide, which Maria is here in the room, she's been one of the lone groups pushing in Orange County for the Virgin Island outreach. But we've also got a lot of other Caribbean nonprofits that are actively working with those communities as well. But what I keep hearing is they feel as though they're not being heard. That's I think most of all the message, and so they're feeling a bit rejected, and I think we do have to be aware of that. And everyone who's here, if I can really have you hear this, please, every time you say Puerto Rico, say Virgin Islands, because it is affecting the people of Virgin Islands, that they're not feeling as if they're being heard as much. So that's, with that said, though, they're here, they're experiencing the same things. They're coming in families. A lot of them feel as though they're going to outstay their welcome at their families. So housing is a major issue, because that's another source of anxiety that I'm seeing, where they just don't feel like they're going to get a job fast enough. They're at families' houses, but they don't feel like, that should be a long-term solution for them. So I think the underpinning thing is maybe jobs and housing as a big factor.
So we talked about some of the sort of contextual issues that are going on, but kind of like at the personal level, what drives you to be involved in these issues?
I try to back away from many times, but what I do is really help the nonprofits that are helping people. that's how I operate. So if I can provide space, and Fashion Square Mall has been a great partner for me, because they allowed us to really, when we wanted to do outreach, just provide space to store supplies, space to do outreach events, and they're definitely a resource that if anyone actually wants to do something to outreach, there are many people walking into Fashion Square Mall from Puerto Rico and Virgin Islands on a daily basis that are lost and just wandering around just looking for advice. And Fashion Square Mall has made that open, that look, if anyone has services and they'd like to have a space there, come and talk to them, because they're committed to doing outreach. So I'm lucky that I'm in a space that is willing to do that. But on a personal level, I just feel that I represent the Caribbean American Chamber. I represent the Caribbean newspaper. And if we don't help these people, there will be, in another year or so, a stigma accompanied with the people from Puerto Rico and Virgin Islands, because they're going to be desperate. And to me, it's just like raising my kids. I don't want them out there embarrassing us. But it means we have to help now. Right. So these are great people. Everyone that's come through my doors, I've enjoyed talking to them. Again, very educated folks. But these are people that you could see they're getting to the point where they're not happy. And I mean, that might be trivializing it, because it's trauma, as Marty said. It's trauma, and it's going to surface. So we really need to do as much as we personally can to help. And so I just look at it as helping my neighbors at this point.
From my point of view, we are the government of Puerto Rico, so we have a ministerial duty to not only support Puerto Ricans, but to help them, to guide them, to liaise and be their voice. So the doors of my office, they have been open since before I came on board, and they continue to be open. Although we moved from Kissimmee to Orlando, we do believe we're still in a very centric and a strategic place where people can come to us, and we can receive your requests via email, via phone, in person, and we're there to assist you. The other thing I wanted to make clear is we might not have resources or programs here because, of course, we're the government of Puerto Rico. Our funding and sources are down in the island, but here the government made an explicit commitment to that we're not leaving them alone or behind. So they may come to us, and we will certainly try to guide them as much as we can in terms of seeking employment, finding partners who can help them with rental assistance, rapid rehousing funding, whether it is through Osceola County or other third-based nonprofit organizations. So that's our commitment. And personally, I am committed as well because I moved here to the States 8 years ago. So I know how difficult it can be to settle and leave your home country and settle in a new place. I have experienced myself issues with my license. I'm a licensed attorney, so everywhere I go, if I want to practice here in Florida, I need to get my license here. And so I definitely feel the connection because I am with them. I am part of it.
Well, personally, I mean, professionally, I've been an educator for going on 27 years. I've served on a Seminole State Board of Trustees for 11, so I've seen the whole gamut. I think that education is really the foundation of our communities, and the importance of that, and personally invested in that and seeing the impact that we can have as a community, the public education system in providing necessary resources and sometimes beyond our resources, and reaching out and bringing folks together to create that community. I think it's so important to keep emphasizing Puerto Rico and Virgin Islands. 400 of our evacuees that came in were from the Virgin Islands, and that's a large number for us to receive. And so for us, as part of the foundation and seeing the work of the Foundation for Orange County Schools as been critical, and the partners that we have, a gift for teaching, having the ability to intake a lot of the resources that are coming in from the generosity of this community, and being able to get it back out in an orderly way and quickly is important. And I see that, and I see how it's really impacting our students and our families. And I mean, it just you know, it's humbling, and but it's exciting to see the success, and to see our seniors, our 82 seniors cross the stage was amazing. So love to see that, and it just we're looking forward to the school year, and it's here already. So we're getting ready to start, and we're going to welcome them all with open arms.
So I remember October 2nd very clearly. I was in my office, and as the vice chair of the Primary Care Access Network, which is here in Orange County, which, if you're not aware of, Orange County many years ago made a very strategic commitment through the mayor's office at that time, and has since been supported by every mayor since, and the county board of county commissioners, to invest in a community network that makes sure that individuals without access to health care services have that through the Primary Care Access Network. And PCAN was immediately contacted when we became aware at that point at the state level that we were going to start receiving citizens from Puerto Rico into Central Florida. Shepherd's Hope has been in the community for 22 years. We have a budget of about $1.5 million. It's very small. Last year we saw almost 20,000 patients on that budget, so we know how to work on a shoestring. And I was with my clinical director of operations when the call came, and they said, we're opening up this operations welcome center. It's going to be at the airport. We need all hands on deck. Dr. Kevin Sharon with the health department was getting ready. His team was mobilizing. Everybody was getting down there. Do you know who can, you know, we're going to need people to greet as they come off the plane. And our team was there. We didn't know how we were going to afford it. It's interesting you talk about budget, you know. We don't know how we're going to be impacted. We still don't know how, you know, we go every day is like Groundhog Day for us. We just keep going out and trying to find it so that we have one more patient that gets what they need. It wasn't a question of would we, it was a question of how fast could we get there, because the need was great and because the individuals that were coming needed a response. They were sick, they were injured, they had something that every human being should have an entitlement to, which is their health and well-being and their sense of self and worth. So that's from the professional side. From the personal side, this is maybe going to get a little emotional. Yesterday, a mom was driving her car in Hillsborough County. She pulled over on the bridge, and she threw her 4-year-old daughter over it, and the little girl drowned. I don't know if you saw it in the paper. There's a lot going on in the national news, and I'm sure it was very small. I have been involved in early childhood development and education and behavioral care for children with special needs going on now 25 years. I get up every morning because that shouldn't happen. I'm proud and I'm honored to be at Shepherd's Hope so that when the men and women and families come through our doors, there's a sense of dignity that we are able to give them. We acknowledge the courage that they must have every day to get up and ask for help. I so admire what you said when we started, which is at the time that the hurricane hit here, even in Central Florida, when Hurricane Irma hit, there was a fire on my front yard. The tree across the street from my house collapsed at the same time that a light pole that was holding the transformer cracked at the same time. It hit my husband's car, and a fire erupted on the front yard of our home. And we heard the crash. My husband ran upstairs to look out my daughter's window, because that's the house window that looks out on the front yard. He failed the IQ test, which is don't yell fire in the house. Call the fire department instead. And we evacuated. We were very lucky. The house is still standing. We had to get a new car. We re-landscaped, but we had our house. Could any one of us be able to say that if we were to lose everything and have to migrate into a community that we didn't know the language, we didn't have a complete tie to anybody else there, familial, we had maybe a couple of thousands of dollars, we were highly educated with a doctoral degree, and we couldn't practice our profession, and we had a child that was getting ready to maybe go to the next step of their life, graduate, go to college, had already been accepted, and now that's a dashed dream, and we're living maybe at a church, could we do that? Could we have that sense of dignity? Would we be able to sustain ourselves? Would we be able to meet somebody with a smile and say, get up that day? Could we do that? And how are we treating the people that we see them every day as they do that? And so to go back to your question, there but for the grace of me and anyone else that is here today, go the thousands of men and women and their children and their extended family members who are here. And I am proud as someone that has grown up here in Central Florida to welcome these Americans into Central Florida from Puerto Rico and to have them be a part of my community. And I look forward to just being able to have them be neighbors and friends and colleagues and do what I can to help support them.
Thank you for joining.
If I may add, we got to keep in perspective, the governor down in the island has done everything and anything he could possibly done at the government level and requested all the emergency aid that was available at the time. But we have the situation where the actual Puerto Ricans or the Virgin Islanders have decided to stay or go back home. It's a very personal decision. They might stay for a variety of reasons. And for those who stay, we need to support them. But for those who decide to come back, there are resources. We actually did 3 events this summer where we brought different housing programs from Puerto Rico to inform them about their options. We also brought FEMA and the Department of Public Safety. And they were informed as to all the options that they had available to repair their houses and get loans, all the different things. But we also brought, as I said, housing department to speak about Section 8 programs who were open in Puerto Rico and public houses as well. So from that standpoint, we have done everything to bring them back if they decide to. The options were presented to them. And they could combine those help from the government of Puerto Rico as well with FEMA government and airfare tickets that FEMA was paying them to come over. But again, it's a decision. If they stay, we are here for them. We're not going to leave them behind. And if they go, we have the resources down there to help them.
So thank you. Just kind of like share some of my experiences after the storm. So when that happened, I was appointed by the provost to be the contact person for everything that happened in UCF, so the information got out there. So I received a lot of calls for a lot of people, and you can feel the desperation. But at the personal level, just kind of like that sense of, everything's going to be okay, kind of like hearing somebody that sort of understands kind of like what you're going through, hearing that familiar face and that familiar tone. And I think that's something that we can do at the basic human level of just listening and understanding to people when they have that time of need as well. But with this, there's also kind of like a little bit of self-reflection in terms of the organizations that we represent, and it's sort of were we ready for it? And from the discussion, it's been that a lot of it was made, sort of at the spur of the moment out here. So can you share a little bit of what your organization didn't do enough of, and something that you could actually change? Just getting ready out here for a future event or any other type of emergency like this one.
Well, we just are in the midst of back to school. And at Shepherd's Hope, in partnership with Morris Children's Hospitals, we've been doing what we call our back to school physicals event, where we're getting kids hearing, vision, immunizations ready to go, make sure everything is paperwork ready so that they can enroll in their county school systems or their private schools. And this year we included emergency preparedness kits in the backpacks, instructions and information, and it was a wake-up call. And one of the things that we learned was that our own staff may not have been as well prepared as they could have been. I certainly didn't. We've had a little preparedness drill at home now about what to do in the case of a fire. and how not to yell fire while you're running out of the house. But for the backpack kits that are coming in, we've included preparedness kits and information about where to seek emergency services and things to do in the event of a hurricane that maybe, I think, and we got some support on a national level from the National Association of Free and Charitable Clinics to help to do that initiative.
And I think on our end, again, I really just work with a lot of nonprofits. And what I saw years ago with the hurricane is we all, of course, actively went out there and everyone got up resources and wanted to ship directly back as soon as the hurricane happened. And this time we tried to counsel people that that's not necessarily the best option because number one, yes, you'll do the outreach, you'll get the supplies collected, but then where are you storing the supplies? How are you shipping the supplies? Who's collecting the supplies? Who's distributing the supplies on that end? And I think we did message that out to a large extent, but people aren't really receptive to it in the moment they want to help. So I feel like major lesson learned is I have to work with other community groups to try to develop some message to our nonprofits that allow them to feel as though they're definitely helping in the moment, but it being help that is really, really going to tangibly help, whether it is working with a trusted official on the island that's affected to get funds to them so that they can really do the work that's needed, or to work with a faith-based operation that actually has boots on the ground so that you're helping to fund that instead of, collecting these donations that are stored and then they get to the wharf, whether in Puerto Rico or Virgin Islands or Dominica, anywhere, and you're not even sure if they get off the wharf. So I just think we could be a little bit more effective in how we help. We were able to pivot really quickly in terms of, all right, people are going to be coming here, so let's actually have resources that will impact the people who are here. So that was something that we were able to do in real time, and I say that we really did a good job, the nonprofits did a good job in doing that pivot. But I think we could be a little bit more effective if we use the time now to actually plan how we can help effectively.
From our point of view, I would say perhaps we could do a more active outreach. This office particularly operates very, very limited budget. We're only 3, and I'm one of them. So you can imagine how much we can do with that little manpower. We do everything and anything. We move, we repair furniture, we do whatever is out there. So setting that aside, we feel that with the resources that we have done our job as the government of Puerto Rico. We were there on the front. I wasn't myself because I was not heading this office. I was in Washington, D.C. actually, when the hurricane hit. I was leading the emergency call center. It was the only line or connection that USA had with Puerto Rico. It was our office in Washington, D.C. So from that customer or emergency line, we were able to save thousands of lives. I cannot even give you numbers. We were able to save the people from Toa Baja, Barrio Ingenio. I don't know if you guys remember that there was a massive flood that the water actually reached the roof levels. All of that request for help was channeled through our office, where we deployed National Guard, the governor, and a lot of other first responders to rescue those residents. So we will continue to do what is there. We need to keep in mind that the needs for these population is ever changing. It might be housing and jobs today. Tomorrow it might be health. So we need to adapt quickly to whatever it is that they need, and we are committed to do that.
One of the things that that my folks who were at the Welcome Center heard over and over again is a lot of the folks said, we wish that this information was on the other side, was in Puerto Rico before they left, so they had some of that information. I think having that outreach on the other side, if we would have had, for example, our HR folks, our student enrollment folks there, being able to work with families so they knew before they left, because a lot of them just came, got off the plane, and then they were in this overwhelming, the Welcome Center was an unbelievable amount of resources and things, but, you're walking off the plane, you're in a place you maybe have never been to before, and you're walking in here and going through that process, but maybe having something on the other side. I think to the point about donations and things coming in, everyone wants to help and wants to give and the generosity, but where do you store it? How do you coordinate getting it out and making sure? And so a lot of lessons learned on that end, who to partner with, where to make sure we're directing those donations to go and getting the volunteer groups together. That's been a huge lesson learned for us. And then working with our demographer and our student enrollment folks to look at trends. What happened? Where did families settle? Where did students end up? Being able to track those through our GIS system and be able to look at in the future. We were trying to look at other types of disasters, even what happened in Haiti when we received a number of Haitian evacuees that came and where they ended up settling to try to see some patterns. But looking at that in order to do some projections on where we would need additional classrooms and additional resources as we were ramping up, knowing what was coming. So a lot of lessons learned on that end. Of course, every situation is different. Every crisis has its own personality and own trend that it takes. But certainly, general lessons on those things we can take away as an organization for sure.
On tracking data, as you mentioned, we got to keep in mind that it's so difficult to track how many came, because, for example, Puerto Rico, a lot of people didn't even enter directly from the Orlando airport. They flew to whatever flight was available, and then they either rented a car and traveled down here, or then took another flight to travel here. So I haven't heard of a single place who has the exact statistics.
Actually,
There is?
really great, well, it's
Okay,
not,
give me the
I don't know
source.
if it's great, but there's a demographic trend piece that I saw, and it was done
The cell signal?
The cell signal.
Yeah, we saw that.
It showed over a period of a month, and then through where they went and
But
where
was it
where the
limited
signals.
to the area codes?
No, it went to the exact. It went all over the country, and you could see it on
But
a
Puerto
daily.
Rico area code phones, right?
Yes, and it
like
went
for
out.
example, I've been living in mainland U.S. For 8 years. I still have my 787
But
phone
it was
number.
pinpointed to the date of the hurricane.
Okay.
And so it showed you from the date of the hurricane, and then you could
Got
track
it.
it by day. So the cell telephones.
Actually, I was along the lines. I was going to say, perhaps you guys that are enrolling kids in school have the most comprehensive
most
number.
accurate. Yeah.
But of course, you're dealing with the child who is enrolled, and then you do capture the family composition as part of the registration process. But again, what about those who doesn't have school-age kids, or those who are mature enough, elderly? There's no single point to track all of those who came, whether from Puerto Rico or from the island.
You know,
So
and
it's so hard to tell.
And there is this was a very emotional thing that we saw at the Welcome Center, and then it was happening later on. And it was very traumatic, some of the patients reporting to us that as they were coming over and they were being established here in the community and they were given identification information, their old identifications were literally being cut up in front of them.
Oh, wow.
And that was very traumatic.
Yeah.
And it was taken.
Because they weren't prepared for that. They don't know that's the procedure. Just surrender your license so that they give you the local one.
To your point about anyone that might have considered about wanting to return home, some of the questions that we've had come back to us, because our patients now have extended their stays with us, is, I don't know if I can. These are my new papers. These are my new IDs. The whole concept, the physicality, I know that there's a process, we know that, but the the emotionality of having that
when
literally
you're
cut.
emotionally sensitive, but it adds up, and it doesn't allow you to see things clearly as we all could.
Which, again, just brings us right back to we just definitely just need to talk more, have more areas of dialogue, whether it's, I know, the people of the Caribbean just generally love festivals and those outreach events, but we need to do more things to engage and just to have those conversations. Yeah, if you want to return home, it's very simple. These are the first steps. So it's really the conversation. It's really that, I think, that's needed more than anything else at this point.
And kind of like back to the number issues, and this is something as a sociologist I'm looking at, and I think there's kind of like that need to have a systematic place where you can have that information, because we really don't know. I mean, the cell phone can tell you the usage of the cell phone, if you had a cell phone, 787, all those sort of things, and we have wild estimates from 300,000 to 20,000 people coming back and forward. I can tell you from personal experience that my in-laws came for 4 months here, and they still receiving mail to my house, but they're in Puerto Rico. So it's kind of like, even knowing the ones that came here but came back or are just doing the circular migration, which is a pattern that is very familiar with a lot of Puerto Ricans even before the storm. So it becomes a challenge, but that's something that, the institutions that we have in place, that we could sort of track that a little bit better. Because, we sort of improvise at doing the emergency out there. We have kind of like 5 minutes or so I'm going to have just kind of like one last question or two questions out here before we open it to the floor. So all the organizations here, do you work together and communicate frequently?
I just emailed Scott 11 o'clock 2 nights ago.
How about the rest of the organizations?
I
met
Marnie
about a week
at
ago.
the Hispanic ComNob again. One of the organizations that we support we support a lot of organizations, very wide ranging, and I met Marnie less than a week ago.
I'm not currently working with any of them. I've just met them. I assume office again in April, so I'm still learning who the community leaders are, what services do they offer, and how to partner with them. So I'm looking forward to establishing lines of communication with all of you and to partner to do great things.
No, and I think that's kind of like one of the lessons learned as well, that we need to find a better way of communicating who's doing what. Yes. And identifying people and all sort of stuff.
Sometimes there's overlap too.
Oh yeah, no, there's
and I would say again, in the case of Orange County, I can't speak for Osceola or Seminole, but certainly the primary care access network inside Orange County is an excellent opportunity, and it was built and has been functioning for almost 2 decades now with that particular need in mind, and all of the agencies within the community. We meet on a monthly basis. Talking about all the hospital systems are there, the school systems are there. Anybody that touches an individual that has an access to health care need is going to come through. One of those agencies is going to be sitting at that table.
Yeah. I do want to point out that Commissioner Siplin and the Mayor's office, they really make a concerted effort to certainly try to keep us in the loop and try to connect us with people that are, either needing service or doing service that are similar, so that we could actually work with them.
I think the snapshot of what emerged at the Welcome Center and who was there is probably a testament to just how knitted the Central Florida community is among the social service and school and government agencies. And one of the things I'm working right now in our own Orlando Economic Partnership, and one of the tenets of that about talking about Central Florida as we try to attract new business here and cultivate our region, is remarking about the fact that among our governments of Orange, Osceola, and Seminole County, the fact that they're here today even, that's one of the highlights of our community. It's one of the reasons why I think our community exemplifies what regionalism looks like and how it should function as agencies and governments and nonprofits and businesses all work collaboratively for the benefit of the community as a region, not just isolating. And I think we see that as new businesses cultivated into our community. They remark, I hear it a lot, and I'm sure you hear it too as part of what you do, and You may have experienced that. It's one of the things that's remarkable about our community is
It
they
is.
come in from other areas and they say, this is not what we're used to. Governments don't normally look at what we're doing here today as a great example.
Yeah, no, absolutely. I could echo that in terms of, sort of the amount of support and how welcoming it was for a lot of the people that had to be displaced by the storm. So thank you all for the work that you do. The last question is, we talked about some of the advice that you will give providers to deal with this sector of the population. Any other type of advice? And we talked a little bit about cultural sensitivity, language, all those type of things. Any other type of advice that you could give here today?
Squirrel away for winter. One of the things I think, and I don't mean to make light of that, but when the hurricane occurred, and maybe that goes back to what's a lesson that we could learn and do differently. From a budgeting standpoint, we're on a fiscal January 1 year. I know the school district is on a little bit of a different cycle because of the state and the count occurring in October and February affects them differently. But we were at the tail end. We scrimp and save to get through our year, and by October, we were just trying to coast into the end of the year and just kind of hope we could make it. And so certainly with the impact of an additional almost 1,500 patients that we were not expecting, and these are one patient had brain cancer and breast cancer and a double lung transplant. I mean, these were not people that were just coming because they had a cold. These were people that were being evacuated in those 1 and 2 first angel flights we were seeing and having to facilitate. And so, maybe putting one of the things I guess is a lesson learned too is kind of just, and it's hard in a nonprofit that's small to kind of, maybe in your organization it's a little bit different, but to kind of just save away for a little bit of a rainy day, but also the community understanding that when we put an all call out, we need help.
Along those lines, like understanding, keeping in mind that rebuilding and helping this community, it will be a collective effort. Not one entity or a government can do it. It cannot be an Orange County government effort or an Osceola County effort. It has to be a collective effort where we all come together to help, because otherwise it will be impossible.
Mm-hmm. And I would say from our end, just really realizing that we do have a lot of resources, especially within our nonprofits. There are lots of retirees in our nonprofits that are really willing to work, and they come with a wealth of experience. And so tap in, like, for example, under the Caribbean American Chamber of Commerce, we set up what's called the Heads of Caribbean Organizations. It was actually in response to the hurricanes about 10 years ago. And it really is just to be a one-touch point to share information with our nonprofit partners. And we've got the Center for Multicultural Wellness and Prevention. We've got mentoring organizations. We've got, again, Virgin Island Worldwide. We've got CAFA down in Kissimmee. We've got a lot of organizations with a depth of people willing to step up and help if only they're asked. So I would like to see maybe better messaging through to us so that we could actually message to them. And I know we're not the only ones. A lot of the chambers have access to a lot of their nonprofit partners, and those nonprofit partners are definitely willing to help. So if we're only asked, we can then send that message, and then you've got soldiers, you've got people that would feel good about what they're doing. They're home, and they will make these people feel welcome. They will utilize their experience to help guide and assimilate those people into the community. So I think definitely just remember that we're out there and that we can help to share those messages with the nonprofit partners.
So let's open the floor to questions. If anybody has a question for our panelists, please, Representative Soto.
Our delegation got about $2.34 million for disaster relief education funding, and I'm hearing from some of our Osceola counterparts that that money still has not trickled down to the school level. So can you go through your estimate on how long you think it'll take for it to flow from the state down to the local level, and what you're hearing from an Orange County level?
Congressman, your guess is as good as mine. I mean, we've been waiting, obviously, for that additional funding. Fortunately, we do have reserves. We're required to have reserves, state reserves. We used a lot of it not a lot of the reserve, but to fund a lot of it through reserves in order to stem that non-budgeted portion of the impact. Of course, once the counts came in February, we were funded for the additional, but still, still looking at, dollar amounts, in the, more probably around $6 million or thereabouts, up to, and I've heard estimates up to $25 million. Just in Orange, Central Florida, but we're still waiting for that. Certainly, we've heard that it's coming, and our folks of CFO and legislative folks have been working on that.
Did state officials tell you that it had to go through them, or that it could go directly from the feds to the local level?
We had heard that it was going to go through the Department of Education and then flow down into, go through the state level and then flow down into the districts based on the data. We were collecting data from all hurricane disasters, Harvey, Irma, and Maria, and then providing that data up through the end of March to the Department of Education. So I'm sure they were using that in order to determine the funding amounts for those students.
Well, I know, speaking for others in the delegation, we're committed to writing a letter to ask for status on it. Thanks for that.
Well, thanks for your advocacy on that, Congressman Soto. It's been difficult not knowing on the budgeting side where it's coming from in that gap time, and we know that you and our congressional delegation was working hard to try to get that money. We know it'll come, and when it does, we'll use it and put it towards resources to obviously put it back into the reserve, but also use some of the additional resources to help those gaps that may exist. So we appreciate your advocacy and efforts.
Hi there, Kevin Sharon with the Department of Health. I would like to ask if there's been any momentum at the state level with securing more rapid applications or people being able to transition licensure from Puerto Rico to Florida, or any of the professions, any of the health professions. Thank you.
I know in the beginning, in the first couple of weeks, we very fiercely through our state organization, the Florida Association of Free and Charitable Clinics, and working with our state legislators, they did recognize nursing reciprocity pretty quickly. The physician reciprocity, as far as I know, still has not happened. I don't know about some of the other ones through the Department of Professional Regulations.
As far as I know, most do not have reciprocity. One thing I can tell you is initially our current governor in the state, Governor Riscott, waived some of the licensees' fees for most of the regulated professions. But as of now, I think that waive is no longer in place. And there isn't a rapid path to transfer a license from Puerto Rico to the state. And I guess it depends. It's tricky and difficult because I guess they need to analyze what kind of training they receive in Puerto Rico that compares to the training that they receive here and what they are missing, and not only get up to date on what they're missing, but pay the fee, take the exam. It's not a simple process.
They haven't made it welcoming.
Yeah, that would be a concern because people have been traumatized. It would be helpful for them in their livelihoods to be able to get back up on their feet and get moving again.
No, and if I may insert, the state of Florida may have an interest on employing all of those professionals who are actually being employed at a different industry, at a different pay rate, whereas they could be actually productive and be inserted right away in their industry. So I agree with you, and to the extent that we could, we will work on that.
Gracias. Hello. There you go. Good morning.
Morning.
My question to everyone in the panel up there is, the welcome centers that were requested by us from Tallahassee, and they opened up because they saw the need for evacuees that were coming here, not only from Puerto Rico, but also from the Virgin Islands. But my question is, do we need to open those centers up again to provide for the families that are still trying to make ends meet, or find out, not refer them, because when you refer a person to an agency, they're going to go through phone calls, or they're not going to be taken care of as promptly as if you have that agency present right there and then. I'm talking about licenses, I'm talking about the school, I'm talking about jobs, I'm talking about housing, I'm talking about health care, I'm talking about everything that was offered to the families when they got here, and then it was closed by the state because FEMA didn't fund it any longer. Do you feel that we should reopen? And Mrs. Torres and Brafa, I think, should lead the way to offer, because I've been to your office, and you have ample space there to accommodate these agencies. Do you think it's possible to start over again?
It would be a wonderful idea. I just want to clarify that we're no longer in that ample space that you mentioned. We are now in a 1,500 square footage commercial office space. So our office space is very limited. If the welcome center is not a possibility, perhaps we can do periodic outreach and go to those underserved communities and bring all of these services that we know the community need. We have done, again, as I mentioned, during the summer, we did several sessions. They were aimed at housing needs specifically because that was a need. But of course, we are clear that there is another array of services that are needed, and if there is an interest, we will be more than happy to lead the way in organizing those. But we do not have the space.
And I think there's a definite need for it. And I, again, you know, we have that Caribbean Resource Center at Fashion Square Mall, but we're not really equipped. All we do is, you know, we hold the people's hands and say, all right, this is where you should go. But I definitely see that there's a need for that to be opened. And, you know, one of the things that I offer is space in our office, certainly for that. But again, Fashion Square Mall, and I'm sure there are other places that have space. There are lots of open spaces. And if we could come together as a community, and if it needs to be furnished, we furnish them, but provide these spaces so that people have places that they can go for a sense of community, we definitely need to do it, I think.
So when the Welcome Center was closed at the airport, they did establish the Mark Center. They put it in a location that was difficult to access, and they didn't provide any information on how to get there. So what happened was it made a justification for the closure of that center easy because it had very little utilization. We staffed it for a period of time until it was eventually closed. And the rationale behind that was it didn't appear to be needed because people weren't coming. Well, they weren't coming because there wasn't an access point for transportation. Many of the families that we're talking about here don't have cars. You know, one of the access issues that we've talked about with affordability of housing and everything else that we've discussed, one of the things that hasn't been talked about is the transportation problem. The number one barrier to access to health care in Central Florida isn't affordability, it's transportation. When I have a patient come to us or we have a patient that needs to go for a secondary care referral, it's not because they can't afford to go, it's they can't get to go. We have to pay for how to get them because they're on a bus or they don't have a vehicle. So I would definitely agree that it's definitely needed, but it needs to be in a centrally accessible location that has community input. All of the access points that we've talked about here today with faith and school and government and business, all of the areas coming together to collectively support it in a location that is has availability to come to, and has a links route in front of it, and isn't hidden.
And now I understand why we see so many people walking through the mall looking for those services. It is because it's on a bus route. I didn't understand why they were just coming to that mall. So maybe there's an overwhelming amount coming to the mall. And so my numbers might be skewed in terms of what the need is, because it just may be that other places aren't seeing those numbers. But there's an alarming amount of people walking around the mall looking for help.
I just say, the point that I'm trying to make is I represent, as a senator, 2 counties, Osceola County and here Orange County. And what I see is, and I've been with the families since the beginning. It's not, I just got on board. And Mayor Alvarez from Osceola has been a tremendous, just like Mayor Jacobs has done her work over here. But when you find that you still have families struggling out there and trying to get a place to live or get furniture for a new place that they're going to move into because they don't have the, what I'm trying to get at is the Central Welcome Committee, where all agencies were present, state agencies, mind you, that this is one of the issues that I have, because the nonprofits group are picking up the ball. They're picking up what the state should be doing. This is the way I feel about it. We pay taxes. We pay taxes for the state to perform and help every family that's in need. But what's happening is we depend so much on nonprofit groups, just like Ms. Downey in Osceola County, Hope. I mean, they're doing the work where the state should be doing the work, and I feel that we need to change the ballgame, and the church groups. Thank you. Yeah. And I just want to make that remark and let say this should be thought of, and maybe we can move on that.
I really agree with you, because I feel like the nonprofits, we're not Shepherd's Hope. We're out of our depth. But we're committed to helping, but I feel like we should be getting messages that we should be sharing. We're just out there helping, and people are coming to us, people are being referred to. I feel like he said, it should be the other way around. We should be being educated about what we should be saying, how we should be guiding the folks, and then we should be guiding them back to a group that follows their progress. I think the nonprofits are doing the best that they can, but it's a very ad hoc process, and I share your concern, because, again, Maria, I would hope you would speak. I think we're out of our depth with some of the issues that we're facing.
So we are about out of time, but before I do so, I want to recognize Danielle Vanegas of the Office of Commissioner Emily Bonilla of District 5. The mayor and the panelists will be available to the media after the event is over. Thank you so much for attending today, and please welcome me in doing a round of applause to our panelists.
Thank you so much.
Thank you.